definitely. We believe these findings certainly will help us to characterize the MS prodrome in terms of understanding that psychiatric morbidity is a contributor of increased healthcare use during the MS prodrome, and it's a component of the MS prodrome. Certainly, we still need to continue defining the MS prodrome and continue defining other morbidities that we can detect during this period. And in terms of clinical implications of these findings, certainly I would say this is too early to consider this can lead to actual change in terms of clinical practice. But what we have to take into account, or what we have to consider, is that during this period that we define as the MS prodrome, there are a number of symptoms that individuals with MS may present before developing their first clearly defined MS symptom that will eventually lead or to a consideration of a demyelinating disease, or to a consideration eventually of a diagnosis of MS. And our goal with this study and other studies exploring the prodrome is to look for defining this period and trying to see if we are able to find any clue into the symptoms that occur during this period, and also to see if there's any of this information that can help us to identify MS earlier that we're able to detect it when an individual presents with a clear-cut demyelinating disease symptom. So I think this is studying the MS prodrome is probably a process that will require doing these sorts of studies many times, going into more detail, exploring the different morbidities that occur in the MS prodrome from different angles, from different perspectives, to see if we're able to detect any clue that will help us to move the diagnostic phase a bit earlier, and that would certainly in the future, and different approaches, for example, trying to use the biological markers that we could be able to measure, for example, MRI, and I'm thinking about, for example, the link between the MS prodrome and the radiologically isolated syndrome, as well as all other biomarkers, for example, serum biomarkers, anything that can help us understand how to move the diagnostic phase of MS earlier. I think that phenotyping the MS prodrome will help us to move in that direction.